Good afternoon, everyone. Thank you for joining us today for this very important and timely webinar. My name is Andrea Lavario. I am a Senior Public Policy Advocate here at HRC. I use she, her pronouns. Over the past 5 weeks, our country, as others, have experienced unprecedented economic upheaval. As of yesterday, 26 million Americans have applied for unemployment benefits, and there are an untold number of part-time and gig workers also displaced. In response to the crisis, Congress has passed critical legislation. Next slide, please. The Families First Coronavirus Protection Act and the Coronavirus Aid, Relief, and Economic Security Act, also known as the CARES Act. These measures include new unemployment benefits and, for the first time ever, federal paid leave benefits. We know many individuals have been looking for and need information about what benefits may be available to them and how to access them. So our goal today is to identify these new benefits, explain how the programs are being implemented, where gaps may still exist with regard to paid leave, and what more needs to be done. Each of the organizations represented today, along with their millions of members, the National Employment Law Project, New America, National Partnership for Women and Families, and the Human Rights Campaign, were part of the incredible lobbying effort to extend these benefits to American workers. In addition, we have new data released just yesterday by HRC in partnership with PSB Research that highlights the impact of the pandemic on LGBTQ plus Americans and their families. It bears out our predictions that the LGBTQ community and other marginalized communities are most at risk in this very challenging time. Next slide, please. With that quick overview, I would like to introduce our panelists. First is Judy Conti, Government Affairs Director at the National Employment Law Project, also called NELP. Judy joined NELP in 2007 after spending 7 years as the co-founder and executive director of the DC Employment Justice Center, a legal service provider devoted to workplace justice in the DC metro area. She is a recognized expert in the field of employment law, often called upon to testify before Congress regarding unemployment insurance, and regularly speaks at conferences and on panels addressing hot topics in labor and employment law. Judy has years of experience lobbying on issues including raising the minimum wage, fair chance hiring, unemployment insurance, wage theft, immigration reform, and other issues involving turning low-wage work into good jobs with a pathway to the middle class. She has been widely recognized for her work with awards from the American Bar Association, the Washington Area Women's Foundation, the Hispanic Bar Association of DC, the William & Mary Law School, and DC Jobs with Justice. In addition to her advocacy, Judy is a widely respected media resource, and we'll watch her online on PBS NewsHour later today. Next up is Vicki Szabo. Vicki is a senior fellow on paid leave policy and strategy with Better Balance Lab at New America. Vicki is one of the nation's leading experts on gender equity and work. At New America, Vicki focuses on charting a path to winning paid family and medical leave for every working person in America, no matter where they live or work or the job that they hold. She works closely with policymakers and advocates, researchers, and business leaders on policy design and advocacy strategy. In addition, Vicki is analyzing the 2020 races for the US presidency and Congress to understand how candidates and the media are addressing issues related to paid leave, pay equity, workplace harassment, and childcare. For 9 years prior to her fellowship, Vicki led the National Partnership for Women and Families Workplace Policy Initiatives, first as Director of Work and Family Programs, and then as Vice President for Workplace Policies and Strategies. Under her leadership, the National Partnership's workplace team helped move national paid leave from a sideline issue into one of the mainstream bipartisan political debate. Her team's most important accomplishments include spearheading efforts to secure federal executive actions on paid sick days, equal pay and sex discrimination affecting millions of federal contract workers, providing technical and strategic assistance resulting in dozens of state and local paid leave and paid sick days laws covering an estimated 45 million private sector workers. She's also as a recognized expert on paid leave benefits. She too has testified multiple times before Congress and state legislatures, as well as in front of the 2016 Democratic Party's Platform Committee. Next, we have Vasu Reddy. She's the Senior Policy Counsel for Workplace Programs, the National Partnership for Women and Families. Vasu is Senior Policy Counsel for the Economic Justice Programs at the National Partnership. Since starting with the National Partnership as a Georgetown Women's Law and Public Policy Fellow in 2013, she has provided detailed technical and policy assistance to advocates and legislators on key economic justice issues, including paid family leave, paid family and medical leave, paid sick days, pregnancy discrimination, sexual harassment, and fair pay. She oversees the partnership's tracking of state and local workplace legislation, monitors federal regulatory and enforcement issues, and provides testimony before state legislatures in support of key paid leave legislation. Vasu was the lead researcher and author of the National Partnership's 2018 report, Raising Expectations, a state-by-state policy analysis of laws that help working family caregivers. And finally, we have my colleague, Robin Nauer Merrill. Robin serves as Associate Legal Director for the Human Rights Campaign. Her work focuses on federal programs, administrative policies, and legislation that impact the LGBTQ community. Robin specifically focuses on healthcare, administrative process and rule of law, non-discrimination protections, and religious freedom. Prior to joining HRC, Robin served as a Presidential Management Fellow at the U.S. Department of Housing and Urban Development in Washington, D.C., in the Legislation and Regulation Division of the Office of General Counsel. We appreciate everybody sharing their expertise with our audience today. We will take questions at the end of the presentations. Our first panelist, Judy Conti, does need to leave a bit early today, and she has agreed to respond to any questions submitted during the webinar in writing, and we will have those on the HRC website. With that, we will start off with Judy Conti.
Hi, everybody. Andrea and HRC, thank you very much for inviting me to be here today on behalf of the National Employment Law Project. My pronouns are she, her, hers. And I am just such a fan of the work that HRC does, and it's a real pleasure to be here today presenting to your constituents and with my friends Vasu and Vicky as well. If we could go to the next slide, please. There are a number of programs that will cover unemployed workers these days, and I want to go through each of them quickly just so folks understand the difference between them and understand who's covered under what. But I want to start by saying if you are unemployed or you are working with people who are unemployed, it isn't important for them to understand every single in and out of each of these programs. It's up to their state unemployment insurance agencies to figure out where they belong. People should just know generally that these are the circumstances under which people are covered, and they should know to go to their state UI agencies and apply for unemployment if they are out of work or they are working less than they used to, and then let the agencies figure out all of the hard part. So unemployment insurance is a program that's up and running all year long and is not responsive specifically just to this current crisis, though of course many people who are losing their jobs will be able to collect it. Unemployment insurance is for people who are employees, those who get paid and get W-2s, for employees who lose their jobs through no fault of their own, basically meaning they don't lose them for misconduct. Some states allow for people to get partial unemployment if they lose part of their job or part of their earnings. Other states will allow people who are only working part-time or only looking for work part-time to qualify. Some don't. If you are in the states that don't and you've got a partial jobs loss or you're only working part-time, then Then there's another program for you called Pandemic Unemployment Assistance that I'll get to in a few minutes. In order to be eligible for unemployment insurance, you must have sufficient earnings in the past 18 months to qualify, and the amount that you have to have varies state by state. So generally speaking, it might be hard for truly low-wage workers or for people who are new entrants to the workforce to qualify for UI, but if you've been working somewhat regularly for the past 18 months, then you'll qualify. Generally speaking, UI replaces only about 40% of your income. It's higher in some states, it's lower in some, it depends on where you are eligible, but it's not full income replacement. It's supposed to be, in theory, higher than 40%, but unfortunately, there are so many states that are so bad at this and have driven their rates down so low that the average is pretty low. And it probably won't surprise you to know that southeastern states in particular, the hardcore red states, are in fact the worst UI states. If you are eligible at all for UI, this is what you'll receive. We'll talk in a bit about a program called Pandemic Unemployment Assistance, and it is for people who are not eligible for UI, essentially, people who are independent contractors, who don't have enough income to qualify. I will note that for some people who work sometimes as an employee and sometimes as a contractor, it might be that they have higher earnings as a contractor, but if you're eligible for UI, you will get that first. The federal government is making the states sequence their benefits first. And generally speaking, you'll get 26 weeks of benefits. There are 8 states that give less. And again, it is to some degree those southeastern states that are represented in the low road states. But we're hoping that states will start moving their rates back up. Next slide, please. 2 other programs related to regular old UI that passed as part of the CARES Act are the Pandemic Emergency Unemployment Compensation Program. And this is simply 13 more weeks of UI benefits. So if you get your 26 weeks of benefits and you still haven't found a new job and it's still 2020, you will be eligible for up to 13 more weeks of benefits. And this is available through the end of the year, though we are already lobbying to extend this well into next year, if not 2022 in addition. If you have already run out of UI, if you're working with somebody who has already run out of UI and there's been like sort of a lapse in them receiving benefits before this Pandemic Emergency Unemployment Compensation Program is up and running, they should go to their state UI websites and reopen their claim and make sure they get those additional weeks. If, however, somebody is up and running on UI now and they run out of their maximum state weeks and still haven't found a new job, then these additional 13 weeks will just happen automatically and they won't need to reapply. But people do need to go in every week that they are unemployed and continue to certify that they are unemployed and that they are either not earning anything or if they have some earnings that week to let the agency know what they've earned. The next program I want to mention is Pandemic Unemployment Compensation. You've probably heard about it. It's a very popular program right now. This is the $600 extra that everybody who receives UI or pandemic unemployment assistance that I'll talk about next will receive this on top of their weekly benefit. This will run through the end of July, basically, unless otherwise extended, and we are advocating already to extend it. And the theory behind this extra $600 is to make people whole for their wage loss. As I said before, UI only replaces an average of 40% of wages. When you look at the average that it replaces and the average that people lose that week, it's basically $600 that they're not receiving. Higher income workers, of course, are losing more. Lower income workers are losing less, but the average is $600. And the states can only handle putting out one uniform level for all claimants. So that's how we derived that $600 number. Next slide, please. Oh, back what? There we go. Thank you. The Pandemic Unemployment Assistance Program. This is a major expansion of UI for this particular crisis. And PUA covers those people who are not eligible for UI, including those who are self-employed, including those who don't have enough wages to qualify for UI because of their new entrance to the workforce or their irregular wages. And it also covers people who are partially or fully unemployed. So if a state does not provide for partial UI, PUA will pick you up. It is retroactive to January 27th, and it runs through 2020. It's the same benefit as the state's UI benefit, but there is a floor on it. It can't be less than half of the weekly average UI benefit in the state. So if you've got very, very low earnings during the 18 months prior to receiving PUA, you'll have a minimum benefit. You won't go all the way down to the floor of what benefits can be. But it does not cover those who can telework with pay or who are receiving sick leave or paid leave benefits, because we want to keep people attached to the workforce to the maximum extent possible. So we don't want to give people the ability to quit their jobs to collect unemployment assistance. We want them to stay on the job if they can. Next slide, please. You can qualify for PUA if you are diagnosed with or seeking diagnosis of COVID-19 or caring for someone with it. You're caring for a child or a household member who can't attend school or work, or some other sort of daycare program, or a sheltered workshop if you've got an adult disabled child, for example. If you are quarantined or have been advised to self-quarantine, you can't start or reach a job, or your place of employment is closed as a direct result of COVID-19, or you had to quit your job as a direct result of COVID-19. And I want to just talk about this last one for a second here. The Department of Labor has been very clear in its guidance that you can't quit your job or refuse to go back to one when people are called back, just because of a generalized fear of being out in the world and exposed to COVID-19. If you are a person of generally good health and you've got no heightened susceptibility to COVID-19, then you are expected to stay on your job if you have one and go back to them when you're called back to them. However, if you are someone who is immunocompromised, or if you live with someone immunocompromised and it is a health hazard for you to be working, that can be a reason to qualify for PUA. And the other thing we're asked a lot is about, what if you're at an unsafe workplace? What if an employer is not enforcing social distancing or letting you wear masks or wash your hands sufficiently, or a whole host of other things? The Occupational Safety and Health Administration is really sort of absent for workers in this crisis, unfortunately. And there's some conflicting guidance coming out of the UI office at DOL. But we certainly believe that should be a covered condition, and that people can make that argument, and there are advocates across the country who are willing to help press that argument as well. Next slide, please. In order to get PUA, you must first apply for and be declared ineligible for unemployment insurance. A lot of states aren't going to make you necessarily go through the full UI application. There are some that may have a shorter application where they can figure out right away that you're not eligible for UI, and they'll immediately move you over to PUA. Many states are going to just automatically review all denials for UI for PUA, but some will require a separate application. It will just depend state by state. So you'll need to go to the state where you want to apply and check what their process is. You will most likely be able to self-certify your income in the first instance. And then once PUA is up and running, you will need to provide documentation at some later date to substantiate the benefits that you're receiving. And the timelines for that will vary by state. We are urging the Department of Labor to be very generous with the period that they allow people to provide documentation. And documentation can include things like W-2s, 1099s, tax returns, bank statements showing deposits of what are clearly earnings, or even affidavits if there's no other documentation. Next slide, please. Some common questions. I just answered the first one. What if I've only lost part of my income but not all of it? If you're an employee, check to see if your state provides for partial UI. If it doesn't, then PUA will likely cover you. If you are self-employed in any way and you've only lost part of your income as a direct result of COVID-19, then PUA should cover you as well. What if I get severance or any payout for sick leave or vacation? Would that impact your UI or PUA benefit? It will vary state by state. There are some states where it won't matter at all and you'll just be considered unemployed and you'll start getting your full benefit. There are some states where it will basically be an income offset until you've used up that money and then you'll start collecting UI. Next slide. And that's it for now. And I'm happy to answer some questions later. Thank you very much.
Great, and now we have Vicki Shabo.
Hey everybody, I am really happy to be here. I am a senior fellow at New America, and I'm really excited to talk about sort of the good and the bad related to emergency paid sick days and family care leave in the Families First Act, which was the second relief bill. Can you hear and see me okay? Sorry, hopefully this is working.
Yes, you're good.
Great, yeah.
Okay, perfect. So as I mentioned, I mean, for a long time, we've had unpaid leave under the Family and Medical Leave Act. There are state and local paid sick days and paid family leave laws in several states around the country and in many localities, but this is the first time that there have been any federal protections. And so I want to recognize that and talk about what they do, but then also talk about some of the limitations and how we might be able to improve. So Catherine can go to the next slide. So here is what folks are entitled to or able to take advantage of right now. And I'll talk about the limitations again in a second, but this applies to anyone who's working in a business with fewer than 500 employees nationwide. And there are some other limitations as well. Also applies to most public sector workers. So there are 10 paid sick days that are available under this law for COVID-related purposes for full-time workers. The usual number of hours worked in a 2-week period for part-time workers. This applies if you have been told to quarantine or self-isolate by a federal, state, or local official or by a health provider, you have COVID symptoms, and you're seeking a diagnosis. That's reimbursed at 100% of your pay, up to $511 a day. This also covers family care. This is care for an individual in quarantine or somebody who's been self-isolating or needs to self-isolate. Also applies to a parent who's taking leave because a child's school or place of care is closed, or because their child care provider is unavailable, or per DOL regulation, cared for an adult child who's incapable of self-care. It does not apply to elder care or other family care responsibilities outside of COVID-related reasons or COVID-related isolation or quarantine. The family caregiving and child care provisions are reimbursed at 2/3 of usual pay, up to $200 a day. And for the purposes of this audience, I thought it was also especially important to pull out who qualifies in terms of another individual that you can care for. This can be an immediate family member or someone who resides in your home, or per DOL's frequently asked questions document, someone with whom one's relationship creates an expectation that you would care for the person in quarantine or self-quarantine situation, and that the individual is relying on you for care during the quarantine or self-quarantine. So it's a pretty good definition in terms of how family or care for another person might be defined. That's like one of the few good things about this in terms of what DOL has done here. That is one tranche of leave that's available, and that is the emergency paid sick leave provision. There's a separate provision that provides up to 10 to 12 weeks for extended school closure leave or childcare leave for new parents. I say 10 to 12 weeks. The law itself is an amendment to the Family and Medical Leave Act, though with greater access to leave than FMLA provides in terms of eligibility rules. The first 2 weeks can be unpaid, or if you have used the paid sick days provision to care for a child and have received pay as a result of that, you can take that as the first 2 weeks and then another 10 weeks. If you've used your paid sick days for some other purpose, say you're quarantining or self-isolating, and then you still also need school leave, you could have the full 12 weeks, but the first 2 weeks could be unpaid, or you could use employer-provided PTO. Next slide. So there are some limitations here, as I said. Just to reiterate, these provisions apply to private employers and nonprofits with fewer than 500 employees. Those businesses do get reimbursed. They get a credit or a refund by reconciling the payroll taxes that they owe. It also applies to state and local agencies and most federal workers. And it applies to self-employed people who can also get the tax credit. And this is, in terms of the evolution of the law and development, pretty interesting and good that self-employed people, gig workers, others are covered. However, as I mentioned, there are significant limitations. Obviously, first and foremost, employers with 500 or more employees nationwide are not obligated to provide any paid sick days through these provisions or paid leave. This excludes about 60 million workers, including, sort of most troublingly, grocery workers, retail workers, food service workers, warehouse workers, others who are working for large national companies who are on the front lines of the crisis. That's obviously a public health issue, as well as a serious threat to those individual workers' health and their family's economic security. As I mentioned, federal workers are covered for paid sick days. Only some are covered for extended school leave. And as a result of some amendments made to the original law through the CARES Act, OMB can exempt executive branch workers if they choose to do that. The Center on Budget and Policy Priorities estimates that about 2 million workers could be exempted as a result of that if OMB were to interpret that liberally or expansively. The other limitation is that your employer, per regulation from DOL, the law says that you have to be able to, you can't work or telework. DOL has interpreted that aspect of the statute to say that your employer has to have work for you on the particular day that you want to take paid sick days or emergency paid school leave. So that's really troubling. Normally, you would have access to a paid sick day whether your employer had a particular task for you or not. We have yet to know how that is being implemented at a work site, but it's something that we're keeping an eye on. Finally, there are some other exceptions and exemptions. Employers with fewer than 50 employees can deny leave for a school closure or childcare to parents if they say that the viability of their business will be threatened, which DOL has again interpreted quite broadly. It's whether it's financial threat or the work can't get done without that person being there or a replacement can't be found. Moreover, there is no requirement that the employer actually apply to DOL or make the case to DOL that they should be exempt. They're just supposed to determine on their own that they are exempt and put that paperwork into their records. So that is a problem. It could affect as many as 34 million workers. And then finally, the other big exception that was written into the law by amendment is that health providers and emergency responders can be exempted by their employers or by DOL. DOL has also interpreted this very broadly. A health provider is defined as really anybody that works in a health institution, a medical school, a community health center. Social workers are included in that. So that has broad consequences to potentially deny paid sick days to lots and lots of people. Emergency responders are also exempted, and that is also defined very broadly. These together could affect as many as 13 million workers. So I think good news, bad news here. For the first time, there are rights that should affect millions of workers, and that should provide protections to millions of workers that go above and beyond any sick leave that an employer may have provided on their own. On the other hand, it may be very difficult or impossible to access. There may be limitations and exemptions that workers don't really have any control over. You can go to the next slide, please. So additional state and local protections. As I mentioned at the outset, HRC and the organizations on this call and hundreds of others around the country have been instrumental in winning statewide paid family and medical leave laws, which are set up as public social insurance funds. Those are in place now in 5 states: California, New Jersey, New York, Rhode Island, and Washington. Folks who do have COVID-related illnesses or aspects of COVID-related illnesses or symptoms that may not be covered by, or complications that may not be covered by the 10 paid sick days under federal law may have access to paid family and medical leave through state laws. There are also paid sick days laws in place in about 11 states and 24 localities. These cover usually routine personal health needs and seeing physicians or medical providers. You could use them in a COVID situation as well. And for caring for a family member who's sick or needs to go to a doctor. Some of these also have public health emergency language in them. You can get details. I'll do a shout out to my old employer and to Bossi's. There are some great resources at the National Partnerships website. I believe the chart is nationalpartnership.org/PSD statutes, and that'll give you the details of all of those state and local laws. And then finally, a couple of states have implemented emergency laws to fill the gaps in federal law. New York, California, and some California cities have started to correct these omissions in the congressional statute. Next slide. So lastly, as we look to the future, what's needed to protect everyone? HRC, again, along with many, many other organizations, have been advocating for fixing some of the gaps and going further. So we need to correct some of these problems ASAP, hopefully in the next relief bill, and need to be advocating for that. For universal coverage so that all workplaces and workers have paid sick days. We would love to see full wage replacement for all of the paid sick days purposes. Right now, women in particular will be disproportionately harmed by the 2/3 wage replacement for family care and school leave because women's incomes are usually lower, their wages are lower. They'll be more likely to take that leave and they'll be less likely to have their full wages replaced when they do. We also need to get the emergency school leave blown back out to include all FMLA purposes. The original legislation that passed the House before a so-called technical corrections vote included up to 12 weeks of partially paid leave for a COVID-related health issue, quarantine, family care, and to care for an adult who is incapable of caring for themselves. That was stripped out as a technical correction without any debate between the Saturday night vote that happened on the second relief bill and the Monday vote, which finalized the bill. But it's really troubling and problematic and presents very practical problems for folks who might take their 10 paid sick days to care for somebody and then they get sick themselves. Or we know that complications now are creating serious health consequences. Many people will be able to access unpaid FMLA leave, but there is no extended duration family or medical leave that is paid in response to this health crisis. And then finally, Congress affirmatively putting exclusions for health workers and emergency responders. That seems very foolhardy when you're trying to flatten the curve and protect public health as well as individual health. At the very least, DOL's interpretation needs to be scaled back. And I'm sure Vasu will talk about that. And small business employees really should be protected and not be deprived of their right to school closure leave at the company's unfettered discretion, especially when companies are able to get reimbursed for this paid time off that they're providing. Lastly, we may not have been in such dire straits if we had had paid sick days and paid leave laws in place to start with. So Broad National Coalition has been working for a long time to win up to 7 paid sick days permanently and to create a national paid family and medical leave fund that would cover personal health issues, serious personal health issues, caring for a family member or loved one, and caring for a new child. And so as we think about the future, think about what it's going to take to get America back to work, to get the economy moving again, to ensure people can have the time off that they need when they feel sick, when they can't be at work because they don't want to and should not be spreading illness, so that employers have systems in place so that all workers have access to paid leave and paid sick days, and so that customers can feel safe. We need to make these policies permanent. That's a longer term advocacy effort, but certainly quite urgent. So I'll stop there. I know there are some questions in the chat, but it sounded like we were going to wait and do that later. So I'll hold for now.
That's great. Thanks, Vicki. And now we have Vasu ready.
Thank you so much, and thank you for having me on this webinar. Like Judy, I'm a big fan of the issues that you all work on and the work that you do. So my name is Vasu Reddy. I use she, her pronouns, and I am Senior Policy Counsel for Economic Justice at the National Partnership for Women and Families. And Vicki used to be my boss. So hi. So I am going to talk about today the federal regulations that DOL put out that interpret the Families First Coronavirus Response Act and the CARES Act, which Vicki just laid out in detail in her presentation. Because she laid those out so clearly, I'm going to, I'm not going to go over those again in detail, just because I think we already have that pretty well covered. But what I'm going to do is talk about the regulations that DOL issued on April 1st that elaborate on and implement the FFCRA and CARES leave provisions. So just as preamble, I'll say that these regulations, DOL issued these regulations on April 1st of this year, and there unusually was not an opportunity for notice and comment, which if you follow federal regulations, typically there's an opportunity for interested parties to provide comment on aspects of the regulation, and the agency has to at least consider these comments before they finalize the rule. DOL got around this by labeling these temporary regulations, but it's clear that there's not going to be another, at least to me, it's clear that they're not likely to introduce another set of regulations. And so these are, for all intents and purposes, permanent, at least through the duration of these leave provisions, which is through the end of this year. And so unfortunately, normally when going over something like this, I would give you all information about how to comment on these regulations, but in this case, we don't have that opportunity. So I just wanted to put that out front, just as a kind of an example of some of the unfavorable, or kind of a preamble to some of the unfavorable interpretations that we got in these regulations. But I'll start actually with with a pretty good or relatively good provision, which is related to the family members that you can take leave for. Next slide, please. So as Vicki laid out, the law allows you to take paid sick time to care for an individual under quarantine or isolation. Now, the law does not lay out or define what an individual, who qualifies as an individual that you can take leave to care for. But the regulations lay out that this can include an immediate family member, a person who regularly resides in the employee's home, or a similar person with whom the employee has a relationship that creates the expectation that the employee would care for the individual under quarantine. And it specifically does not include a person with whom the employee has no personal relationship. And so this overall is a pretty good interpretation of this language, because it can include people outside of immediate family members who, and typically federal law is more restrictive on who is defined as a family member that you can care for. However, I will point out that it doesn't, it still is more restrictive than the actual statute provided for, because the actual statute did not provide any limitations. And so it's in that way, it's more restrictive, but for the purposes of folks who have non-traditional caregiving arrangements, for example, people who are caring for a non-immediate family member, people who have a romantic partner who is not recognized under law, or folks who have other non-traditional care arrangements. This is a real boon as far as having it go beyond immediate family members. The next family definition that is sort of covered by this law is the provision of taking paid sick time or paid or family leave to care for a son or daughter whose school or place of care is closed, or whose child care provider is unavailable. So as the law was written, for the paid leave portion of this, this was limited to a son or daughter who was under the age of 18. However, DOL used their ambit to provide consistency, or to create consistency between the paid sick time and paid leave provisions, to eliminate that requirement that they be under 18. for you to be able to care for them. So what they did is for both paid sick time and paid family leave provisions, they used the definition of son or daughter from the FMLA, which is a biological, adopted, or foster child, a stepchild, a legal ward, or a child of a person standing in loco parentis who is either under the age of 18 or 18 or older and incapable of self-care because of a mental or physical disability. So this is, for this family leave provision, at least, the regulations did expand on who you could take this school closure leave to care for. However, again, as with all things, it is somewhat a mixed bag because, as I'm sure many of you are aware, the phrase son or daughter can be interpreted in a restrictive way to leave out non-binary folks. And so this is a problem with the FMLA, and but also with this particular provision in Families First and CARES that other legislation that is pushing for paid sick days and paid leave would address in a broader sense by just referring to someone as a child rather than son or daughter. This is a big deal, of course, because the family definitions are a big deal in this context, because again, we want people to take as much leave as they can to care for people. But it's also something that comes up in an ongoing context in the advocacy for state and local paid sick days and paid leave laws, and at the federal level. And so our partners at A Better Balance have put together a kind of quick guide on what are the best practices around defining family members in workplace leave laws and policies. So I've linked that on this slide here. The National Partnership has also been involved and signed on to these definitions, and several other advocacy organizations that work on these issues. So if you're interested in more around that, I would definitely recommend checking out that guide. Next slide, please. So again, as Vicki implied, the legislation includes a provision that allows employers to exempt employees who are healthcare providers and emergency responders. And DOL took these definitions and ran with them. They defined healthcare providers especially as in a way that is, to editorialize, I think is beyond any reasonable definition of healthcare providers. So healthcare providers includes, as per the regulations, includes anyone employed at a doctor's office, hospital, healthcare center, clinic, post-secondary educational institution offering healthcare instruction, medical school, health department, and other similar institutions. So this would mean not just someone who's directly involved in the provision of healthcare, but anyone employed at a facility that provides healthcare. It also includes anyone employed by a contractor with any of these institutions that provides services to maintain the facility's operations or support the facility's operations. It also includes anyone employed by an entity that provides medical services, produces medical products, or is otherwise involved in the making of equipment related to COVID, including tests and vaccines. And then it includes this broad catch-all provision that allows the highest official of a state or territory to determine that this profession is a healthcare provider necessary for their response. Next slide, please. Again, the definition of emergency responders is also extremely broad. This includes anyone necessary for transport or care, or other aspects of the response to COVID. It includes military personnel, law enforcement, correctional institution personnel, and also this anyone who is designated by the highest official of a state or territory to be determined as an emergency responder. So this again is very broad. We've already heard, I've already heard personally a story from a woman who is a psychiatrist at a correctional institute that is under quarantine, that has a number of prisoners who are at risk, and problematically enough already that it's already problematic enough that they are subjecting these prisoners to these conditions where they will be at very high risk of being exposed to COVID. But then in addition to that, they are being very broad in their application of who is emergency response personnel among their employees. And so it is just sort of broadening out the risk for that. Yes, so these exceptions are extremely problematic, not just because those workers are at extreme risk of being exposed to COVID, but also because if the purpose of and DOL's purpose in defining these definitions broadly, they declared their purpose to be that they wanted to balance the need for the healthcare system to continue operating efficiently and at good capacity. However, as Vicki pointed out, this is extremely short-sighted, because if you have more and more employees who are being exposed to coronavirus and who are contracting the illness, then you are going to be reducing the capacity of the system. And so allowing people to take the leave they need to avoid exposure is the way that you keep the system operating at capacity. Next slide, please. There we go. Another regulation provision where DOL went an extremely broad direction is the small business exemption from the requirement to provide leave for school closure and childcare purposes if it would jeopardize the business's viability. The partnership and many other organizations were urging DOL to interpret this exception narrowly, to only allow an exemption if the employer determines that providing the leave would shut down their business. However, DOL went in the other direction and did a broad interpretation of this. It allows the employer to determine that providing leave would cause expenses to exceed revenues and not allow the business to operate at minimal capacity. It also allowed the employer to determine that the employee has specialized knowledge or skills or responsibilities that would risk the business's operations, or because the employer can't find enough other workers to perform that work. So again, this gives a lot of leeway to employers to just decide to declare unilaterally that their business would be jeopardized, and there's no review or process for DOL to push back on this, or for employees to seek redress if they think that they've been wrongly determined to be exempt from this. And employers are not required to submit anything to DOL. They only have to keep a documentation of this determination in their files. Next slide, please. Some other issues that have come up around in the regulations, again, as Vicki pointed out, in order for the employee to qualify for leave, the employer has to, quote unquote, have work for them. So if the employer doesn't have work for you, then you're determined to not be eligible for leave. And again, this gives a very broad leeway to employers to simply unilaterally declare that that they don't have work available for you, and there's no real way to challenge that. And I should specify that this only applies to the leave to deal with your own quarantine, or isolation, or for a family member's quarantine or isolation, or for school closures. It doesn't apply, I believe, to the self-diagnosis or the substantially similar conditions leave. And it's not really clear why. Another problematic provision is that any FMLA leave the employee has already taken counts against their allotment of how much emergency family leave they're available to take. So under the law, employees have to receive 12 weeks of, have to have 12 weeks of family leave available, up to 10 of which would be paid. But if an employee has already taken FMLA leave, for example, if they've had a new child in the last year, or if they have been caring for themselves or a family member with a serious health condition, they would have that amount deducted from how much emergency leave they can take. This is especially problematic for new parents, for people with chronic health conditions, or with caregiving responsibilities. And those are precisely the people who need to be able to take this leave. And then finally, it takes the regulations add documentation requirements for employees taking leave that are not included in the statute. And this includes a sort of very broad provision that the employer can deny leave if the employee doesn't submit documents to support the employer's application for the tax credit. And then it doesn't specify what those documents are. And so again, it just gives a lot of leeway for bad actors to declare that, oh, I don't have enough documentation from you, and so I can't give you this leave. So, there's a lot of problems with these regulations, and unfortunately not a ton of regulatory avenues to challenge them. DOL has been doing some listening sessions while they were working on these regulations, and so it's possible they will come up with more of these where people can weigh in. But at the moment, I think the best avenues for correcting these regulatory issues are advocating for state and local fixes to fix the holes in the legislation and in the regulations. So basically, a law at the state level saying that, a person does not have to add these documentation requirements, or doesn't have to have an employer who has work available for them, that would at least duplicate this program on the state level, but without these unnecessary requirements. And then the other avenue, I think the best avenue probably, is advocating for these provisions to be fixed in future COVID federal packages. So it can be as simple as, including a specification in adding a specification to Families First or CARES that would eliminate the ability for these interpretations to be taken. And then finally, I'll just note that the New York Attorney General has filed a lawsuit challenging 4 specific provisions that I've laid out here. The emergency responder and healthcare provider definitions, the documentation requirements, the requirement that the employer has to have work for you, and then, oh gosh, I'm blanking on the 4th one. Also a provision around intermittent leave and requiring the employer to give permission for you to take your leave intermittently, which is also not in the statute. And so I have not heard about any other states that are interested in challenging this, but I would say if you have relationships with your state attorney general's office and you think they might be amenable, it's definitely something that I think would add to the pressure on DOL to change these regulations. Next slide. So that's all from me. I'm happy to answer your questions after this is done, and my contact information is on the slide if you want to reach out further.
Thank you, Vasu. Now we have HRC's Robin Merrill, and due to time constraints, obviously there was a lot of information to unpack here, and I'm sure a lot more that could be unpacked. We are going to respond to questions in writing, so if you have a question on anything that you've the presenters have already gone through, if you would just please type us up your question, and we will make sure that it gets responded to when we post all the questions online. So without further ado, Robin Merrill.
Hi, everyone. Thank you so much for joining us today, for Judy and Vasu and Vicki for joining and sharing their expertise. It's been very, very valuable. What I wanted to cover just to conclude was how COVID-19 is disparately impacting LGBTQ people and how paid leave fits into that. So, next slide. So, as a rule, LGBTQ people have always faced significant economic disparities. And I think that what we're seeing with COVID is that if people are already in a population that is traditionally marginalized, or if folks are already part of a traditionally marginalized population, already suffering from health disparities or isolation, or under coverage for things like health insurance and paid leave, unfortunately, COVID-19 is going to be no different. We know that LGBTQ people face an increased risk for poverty and have lower incomes across the board as a result of really systemic discrimination that causes housing insecurity and exacerbates these health disparities and social isolation. We know that same-sex couples, for example, who are parents are twice as likely to be living near the poverty line. And so a lot of the folks that we're talking about today that will need paid leave for caregiving responsibilities, they are already really at that breaking point that COVID really could break them. Single LGBTQ parents, that risk for poverty is even higher. And I have to mention that for LGBTQ folks that are living at the intersection of multiple marginalized identities, this systemic discrimination and incidence of poverty is even greater. Next. So what we do know from research that we've put out just this week is that LGBTQ people are going to experience a heightened economic impact of COVID-19 on their families, both short and long term. 30% of LGBTQ folks that we surveyed have reported that they've had reduced hours. That's 30% compared to 22% of the overall population. 20% of LGBTQ folks say their personal finances are much worse off than they were a year ago. And again, this is almost double. It's compared to 11% of the general population. And the exact same percentage believe that they're going to be worse off a year from now. So 10% of LGBTQ people versus 5% of the general population. And 42% of LGBTQ folks have already adjusted their household budgets compared to 30% of the general population in response to this pandemic and the economic impact of it. Next slide. Why are LGBTQ folks more impacted? Because they're more likely to work in the industries that have been directly affected today and over the last few months. They have more exposure and a higher economic sensitivity to the COVID crisis because of that. So the top 5 industries in which LGBTQ adults are likely to work, you'll see from this list on the PowerPoint, they're the industries that have been most impacted. So 2 million or 15% of LGBTQ adults work in restaurants and food service. 1 million, which is 7.5%, work in hospitals. 1 million are teachers or staff in K through 12 education. 1 million work in colleges and universities, and 500,000 work in retail. all of these industries have been so hit by the COVID-19 pandemic, people have seen their livelihood just dry up. Next. Oh. So as I said in the beginning, you know, COVID-19 really does sort of shine light on the cracks that are already existing in our safety net and in the security of LGBTQ people and other marginalized populations. So LGBTQ people have always struggled to access the paid leave that they need and the leave that they need. And the thing is that even if an LGBTQ employee has access to paid leave on paper, the existence of discrimination and the threat of discrimination persists, and people might not actually want to take it for a stepchild or a same-sex partner if that means having to come out to an employer in a state where they still have the threat of being fired. So LGBTQ individuals face these higher challenges accessing paid leave. And as I said, the fear of discrimination, because we don't have federal uniform explicit non-discrimination provisions, prevents 1 in 5 workers who are LGBT from taking the paid leave that they otherwise have on the table for them. And that includes both disclosing their LGBTQ identity, which could be any caregiving relationship, whether it's, again, the child of a same-sex partner, the same-sex partner themselves, the same-sex partner's parents, all of those things that I think people might take for granted, that yes, they can access that. If it means disclosing their LGBTQ identity or their HIV status or their partner's HIV status, they're not going to do it. So without these federal protections that are explicit, again, statutory explicit protections, LGBTQ people have little recourse when they face discrimination. And this just undermines the physical, mental, and financial health of LGBTQ families across the board. So as you can see, COVID-19 is absolutely hitting our community as harder than many communities. And our workers are really, really struggling, and the gaps that are in the paid leave safety net are felt even more acutely by our folks.
Thank you, Robin. Really appreciate your presentation, as we have for all of our presenters, you, Vasu, Vicky, and Judy. Again, if folks have any questions, because we are out of time, if you would please type them in the chat box, and we will respond to those questions in writing. Give us a few days to do that, but we will get them responded to and posted on the HRC website. This webinar was recorded, so you will also have access to it in the future, and we will have it also posted on the HRC website. I thank all of the presenters, and I thank all of you for joining us today for this very important webinar. Have a good weekend.